it'll give you a number, okay? So this is the base equipment. And like you see, it comes with different numbers of emitters. It'll say number 1, number 2, number 3. Okay, and each one is connected to a specific emitter, and I'll go over that. And also, it has a converter because this machine is made in Russia. Because of that, because they have 220 volts there, and we have 110, you need a converter that will convert the higher energy to lower energy. So when you turn it on, I have to keep this in a place that you can watch. Where is the closest plug-in?
There looks like there's one right here.
Okay. So I'm going to plug it in.
See, I think they were gonna try to do
This
this.
is only for you guys for quick.
Yeah.
Like I said, it's going to be a quick session for you, and then you can review this afterwards. So you plug this in. This doesn't go too far, so you want to make sure it's. And this has 2 setup. One, it says output is 110, output is 220. So make sure you're connected to 220. Because sometimes people make a mistake and then the machine will stop working in between.
Can I ask you to hold this? I just have to get this call. Thank you.
So did you get what I was saying? So
220?
so here you can point it to this area. So see like how it has 2 setup, 110 and 220. Make sure it is connected to 220. Okay. So you will turn this on first. Turn this on, and this switch here. You can come to the front. This has to be turned on, and this is the time that's set up for like for the program. But initially it comes up with a number, so you will change the number if in case you want it. Each number means a program, and after you turn it on, it will tell you how many minutes is going to run. So initial number that comes up is the program number, but once you turn it on, it will be the amount of minute it's set up. Let's say I'm going to start it at 59. It'll say 15 minutes. 15 minutes is the program it's going to run, but the initial number that comes up is actually the program number. So if you want, you can go up and see what is number 59. This is the machine, this is the program numbers. So you can figure out like what is the number we are running. So if let's say you want to run somebody's who has one of your patient, think about like somebody who can benefit from this program. Who would be somebody you would choose?
Pain-wise?
Pain or disease
Well,
or
I know that you were using on Mary Blaney.
okay.
It was this machine,
Oh,
right?
I was using a different
A
machine.
different machine, okay.
So you want it for arthritis?
Yes,
Like you're looking
we
for.
have a lot of knee arthritis,
Okay.
and back, spinal stenosis.
Okay. So let's go back to that. So it goes by system. If you go here, when you open the book, it'll be listed according to the system.
Okay.
So if you go here, it'll say initially. It'll say nervous system disease. So you will it goes through all the nervous system, and since we are looking for specifically for arthritis, we are going to go to the musculoskeletal system. Let's see which number is that. Do you know whether it's osteoarthritis or rheumatic arthritis she has?
Usually osteo.
Osteoarthritis. So osteoarthritis is in page 25, and the program is 37. This is called osteoarthrosis. And if without synovitis, so it will be number 37. So we are going to figure out to bring. Let me take out the emitter. The emitter is sitting. So this is the flexible emitter. They call this flexible emitter. We can put it in the second. That's why, like, it's nice to hang it. The other card has the hanging ability. And I also gave her these. See here. What you do is,
Oh,
okay, so here. No, what I told her is to just hang it like this.
oh, I see, okay.
I have to get her the different card. I should put it together for her. That way she knows what to do. So the other one, I'm gonna hang it like this so it'll be easier. Then you guys can. And also when you wanna open it, open this whole thing and leave it hanging like that. So you'll be able to access it. Okay, so let it hang like this on the side.
Oh, that does make
So
more
it's
sense.
easier.
Yep.
And this is heavy, so you might not be able to hold it. So now,
Okay.
what I'm going to do is, oh, there it is. So since we are going to address the osteoarthrosis, we are going to program number 37. You can either do it up or down, it doesn't matter. One way changes it this way, one way changes it this way. So it doesn't matter, but you need to come back to this number 37.
Okay.
It goes up to 78 programs.
Now,
79,
it would
okay.
take a doctor to order this. It would be yourself that would order it and set up the
Yeah,
parameters.
yeah, so
etc.
we can figure out like, what is, but like, eventually you'll be able to say, hey, I need this program, can you just do a TO, how you guys are doing?
Yes.
So you will
With
eventually be
familiarity
able
with
to
it.
get there, because all this is here.
Okay.
What I'm gonna do is exactly like what you tell me eventually. But right now, like, I'm gonna show you, so you will figure out what is going to work for her. So this 37, so you need program number 37. So in this, once you go there, once you figure out like program number 37, it says it is 15 procedures. So the total procedure you want
I
to do
see.
is daily for 15 if you can, or if you're doing only on weekdays, do 15, like 5 per week,
Yep.
and then switch it. Or if by chance you have insurance requirement, if there is a therapy, part that they can only do certain time a week, use therapy, and non-therapy days, like when you have passive movement and stuff. So you would use it during those time where you have a downtime, not exactly therapy. So you can combine it and do it.
Okay.
And then the emitter, it says, is only basic emitter. So it is looking only for the big one. It's not even looking for these, even though everything is on. So when you turn it on, all comes on. But when you turn the program on, some will shut off. Because if by chance it's not part of the program, it's going to shut off. So then it says here, without evidence of synovitis. So you want to make sure it's not like acute inflammation of the joint and stuff. Because this setting is like for deeper setup. For synovitis, since it's like, more on the ligament and the tissue place, you want the tissue penetration to be a little bit superficial. So you are targeting a deeper area. So that's why it's saying, like, to make sure there is no synovitis, because then the patient is not going to feel a relief. So after you finish the treatment, they'll say, oh, it didn't work. That's because we haven't addressed those tissue. So you want to make sure, like, you're addressing what the problem is. And then
So
afterwards,
is there any correspondence to, like, the higher the number, the deeper the penetration?
no,
or there's
because the
no-
program is set up in the machine.
Okay.
There's nothing wrong. Actually, you can use even superficial setting, deeper setting.
Okay.
But sometimes the reason I'm saying is, let's say there is a problem in the muscle, right?
Yeah.
You're treating a bone, you're going to waste your time, because after 20 minutes or 15 minutes, you come to find out patient never even felt a relief.
Okay.
So then they're going to still complain, like, I don't feel a relief. So it is going to work at the deeper end, but you also want to address what the problem is. You want to symptomatically treat it first,
Yep.
and then address the issue. Like osteoarthritis might be the big picture,
That's right.
but the acute issue is this. So you want to address the acute issue first, and then go for the big issue.
Okay.
You understand?
Okay.
So now, it says here, the treatment time is only 10 minutes.
Okay, I wondered that.
And then the induction is 10 millitesla. That's what, but it's all pre-programmed. You don't need to. So what you're going to do is, in your treatment order, you're saying, I'm doing magnetic PEMF unit with induction of 10 mTAI, frequency of 100 hertz for 10-minute duration. That's going to be like the order, and we're going to do a 15 procedure. So you would have a specific parameter and you're going to do it, okay? And the way it works, like again, I said, it's only lymphatics it's going to manipulate. But why it is important to manipulate the lymphatics? Unless you take out the fluid, you're not going to bring oxygen in. Unless you bring oxygen in, the patient is not going to have the energy to address the pain. And pain is relieved only when all the dirt is removed from the lymphatics and the annoying insults are gone and new oxygen flows in, so they feel the relief and energy.
Okay.
So you will address both issues by doing the PEMF.
Okay.
And if you want to do antiphoresis, you will do on addition to the knee. You can do Kenalog cream or dexamethasone cream or whatever you guys usually do, Decadron cream. I mean, it doesn't matter what you use. And you can even use Bengay, methyl salicylic acid like Bengay cream or Aspir cream. It doesn't matter what you use. You
Okay.
can do that, and if you do this, you would have a deeper penetration of medication too. So you would have like better pain relief with that.
Okay.
So you can build that way too. Okay, so then we are going to turn it on, and when we turn it on, you can see which emitter turns on. See, so I'm going to show you. So this one, green light is on for this, and this is already off, so it's not part of that parameter. So it looks like it's looking for those two emitters. So I'm going to turn it on. It's 10 minutes, and this is flickering, right? All the lights turned on, which means this is the one it's looking for.
Yes.
This is off, and this is off. So
Okay.
you're not even going to touch it. So you're going to take this out. And when you use for pain management, the blue is the side that it's going to put energy in the body. So you want to make sure the blue touches the skin.
Okay.
The red is the part, the south part is actually activating the body. So you don't want to overstimulate a painful area. So you want to keep it away from the body.
Okay.
Generally, most of the program is designed so that the blue touches the body. So
Okay.
always think blue has to be on the skin.
Yep.
If they're going to lie down, this will be facing them.
Yes.
If you are going to put it on top of them, you should see the red.
Yes.
Okay?
Got it.
So you will wrap the whole knee. So if you want, you will, for her, you'll wrap it. And you can put a towel on top, or you can put, this has like a thing. So you can actually attach it to it. And then leave it for 10 minutes. And after the 10-minute session is done, it'll make an alarm and it'll shut off
It shuts off automatically.
automatically.
Okay.
And meaning shuts off, meaning it'll alarm and it'll go back to the number 37. So then this is turned off when say it's right now 9 minutes. So it goes back to 37. And if you want another session, you just turn it on again.
Okay.
So you can do multiple times if you want to different knees. Keep it in the same, because it doesn't matter whether it's left knee, right
So
shoulder.
is there any time in between 10-minute sessions that you have to wait?
No, because you're going to treat different areas.
Okay, so if it's a different
So if you can
area-
rotate, you can rotate.
You can.
Same area you can
Okay.
treat further too. You can,
can.
you can, because it depends, whether they are able to tolerate the treatment. Sometimes, you don't want it to be giving pressure, because ultimately it is creating a immobility to that area and pressure.
Okay.
So this is good. Okay.
Thank you, Ellen.
Thank you so much.
Ellen, did